Normal bowel function, Roy, Gary, Derek, and Kara. Overview of the GI tract, normal bowel function. We have the anatomical structures of the GI tract, which start with the upper GI tract, the small intestine, the large intestine, and the rectum and the anus. So starting at the upper, the food is torn into small pieces, mashed and moistened with saliva when it's put into your mouth, formed into a bolus, and swallowed down into the esophagus and the stomach. The small intestine is where most of the absorption takes place. It's a combination of folds and villi that are great for facilitating absorption of nutrients. The large intestine extends from the ileum, and this is where the bile salts and the rest of the water is absorbed. Finally, we have the rectum and the anus, which is a highly vascular folded tube. The rectum is free of waste products until it's time for defecation. The upper GI tract contains the mouth, pharynx, esophagus, and stomach. The mouth is where digestion begins when you put the food in your mouth and you start chewing. Once you swallow, it goes down to the esophagus where peristalsis begins as the bolus is pushed towards the stomach. The stomach is a sac that extends from the esophagus to the small intestine, and we'll see in the next slide. The small intestine. It's a folded, twisted, and coiled tube that connects the stomach to the large intestine. It's made up of the duodenum, the jejunum, and the ileum. Now, while the food is in there, peristalsis stops so that the food can have its nutrients absorbed. And most digestion and absorption, like I said, occurs here. Now we have the large intestine, and this is where the undigested food entering the first portion of the large intestine, the cecum. This consists of mostly cellulose and water. So we have the ascending, transverse, and descending colon. They ring around the small intestine. Finally, the sigmoid colon is the final stop. It's the segment of the bowel that twists medially and downwards, connecting to the rectum and the anus. The colon also secretes mucus, which facilitates a smooth passage of stool and absorbs the water, vitamins, and minerals. Last but not least, the rectum and the anus. The anus has two ring-like muscles that function as sphincters. The internal sphincter, this relaxes and opens involuntarily when stool is present. This is giving you the feeling where you have to go. Now we have the external sphincter, which we can control. So this allows us to control those moments when we're having difficulty finding a place to relieve ourselves. We can hold until that moment. The anus is highly vascular. Chronic pressure on the anus, on the veins in the anal canal, combined with prolonged sitting, can cause hemorrhoids, which are very painful. Preparation H is something that you can use to soothe that.
All right, now we're going to talk about the physiological process of defecation. As we know, food has to go through the GI tract before it can make it to the rectum and the anus. As we also know, food sometimes can be solid or liquid. Whatever it is, it ends up making its way towards the rectum and the anus at some point. When it goes through the descending colon and makes it to the sigmoid and starts to reach towards the rectum, what's going to happen is something known as distension. Distension is basically a stretching of the folds. When that stretching occurs, you will have receptors known as stretch receptors that are basically stimulated by that mechanical stress that will send a signal to the sigmoid colon that will force the feces down through the rectum towards the anus. Once this happens, the anus will start to relax its internal sphincter. As humans, we don't really have any control over this one. We do have control over the external sphincter. And what happens when the internal one relaxes is that we suddenly get this signal sent to our central nervous system that creates that sensation to go. We get this sense of urgency to go to the bathroom. So as those nerve impulses start to fire and you start to produce that bowel movement, if you're a healthy individual, you can actually facilitate this movement by what's known as a Valsalva maneuver. That is where you hold your breath and contract your diaphragm, and that will help force the feces down and out of your body. Next slide. So, what is feces? Feces, or stool, is, in a nutshell, processed food. As I mentioned before, it could be either a solid or a liquid. Either way, if it is a solid, it's going to end up as feces. So it goes through the GI tract, and at some point, it's going to mix with stomach acid and some of the water in your body, along with all the other chemicals that get secreted to help facilitate digestion, such as chyme and bile salts. As it moves through the large intestine, much of that water and much of that chyme actually gets removed, creating the solid form of feces that we know. Now, the bile salts are interesting because bile salts, when they're secreted, are typically yellow. However, due to a reaction with the bacteria through the large intestine, it actually turns brown, which is where that iconic brown color from feces comes from. It's also where the odor comes from. Next slide. So now let's talk about normal bowel pattern and normal stool. This is a broad concept. Normal bowel pattern can't really be locked down to one specific cycle. Everybody's different. Everybody has different genetics. Everybody has different patterns. So you could have a bowel movement once daily. You could have 2 to 3 a week. You could have 1 a week. Like I said, everybody's different. The criteria for what constitutes a normal bowel pattern can be laid out like this. As long as the person passes stool without any excessive urgency to go, minimal effort and no straining, no blood loss, and without the consistent use of laxatives, you can regard your bowel function as normal.
Now we're going to discuss normal bowel movement. And there's 2 different ways that waste is moved through the colon. Hostration and peristalsis. With hostration, the movement is done circular with circular muscles, and it's absorbed, helps the fecal matter to absorb water into the walls of the intestine. When you're auscultating, you're going to hear noises 5 to 15 seconds apart, called borborygmus. That'll be the gurgling sounds. And when it's a peristalsis, the peristalsis is the longitudinal movement of the stool, and it's a mass movement where the colon contracts together to accelerate the stool into the rectum. That's going to happen at right after mealtime, and also 5 or 6 hours following that. And it's triggered by the gastrocolic reflex from having food in your stomach, as Riley had talked about earlier. Next slide. Normal stool, it kind of depends on what you eat or how much you eat, but we'll speak to an average of 150 grams and an average diameter of 1 inch and about the size of a large breakfast sausage. As Riley had talked about, it's going to pass easily, and it's going to be the consistency of I'll move on. And the smell, again, is from the bacterial action, and it's the indole scatole that actually also is the smell you have in flowers at really light concentration. And then that's it.
Okay, so now we've got, we're going to talk about patient education about common factors affecting normal bowel elimination. Next slide. So developmental stages definitely affect it. Newborns, they pass meconium. It's a greenish, black, sticky, tarry, odorless stool. And the contents of it are from mucus, hair, and amniotic fluid, and it happens during the first few days of life. After that, they kind of go through a series of different types of stools as they grow. Children, they develop the ability to control their bowel movements around age 2 or 3. Potty training is actually quite complex for them. It takes, control, effort, the awareness, control of closure of the external anal sphincter, being able to get there on time, remove their clothes and whatnot. As they grow, they gain more control over their bowel movements. Adults with a decent fiber, water intake, and physical activity, adults usually have a set bowel pattern that they continue from childhood. As we age, as we age, peristalsis, perineal muscle tone, intestinal smooth muscle tone, and sphincter control, they lessen a little bit as we get older. Next. Personal and sociocultural factors. So the type of job you have can definitely affect it. If you're working a very fast-paced, very busy job, a lot of times people will either have struggle with noticing the need to go, or ignore the need to go. And then if you have children, a lot of times people who have children or infants will a lot of times put off their need to go because they don't want to leave the children alone. And there's also the embarrassment factor. Some people do not like other people, they don't like the thought that other people might realize that they're having a bowel movement. They might put it off until they're alone, which definitely can affect the normal bowel function. Stress is a factor that can have a huge impact on normal bowel function. It's also one of the major risk factors in having irritable bowel syndrome. And stress can cause constipation or diarrhea. Next. And here we have some factors regarding nutrition, hydration, and activity level and how that affects it. Some negative effects: irregular eating schedule, inadequate fiber intake, inadequate fluid intake, causing hard, dry stools. Excessive fluid consumption with especially sugary fluids can cause fast movement through the colon and cause very soft or watery stools. Coffee can increase peristalsis or cause you to have softer stools. Milk and large amounts in calcium supplements may cause constipation. Magnesium supplements may cause diarrhea, and excessive vitamin C may trigger diarrhea in very sensitive individuals. Activity definitely has a positive impact on healthy bowel function. It can increase peristalsis and overall just have positive effects on that. Individuals who lack enough exercise can have weaker muscles and experience more constipation. Next. And here we have some medications that affect bowel function. Antacids may slow peristalsis. Aspirin and NSAIDs, consistent use can irritate the stomach or the duodenum. Antibiotics, the numbers of normal bacteria and flora in the colon are decreased, which can lead to diarrhea. Iron supplements may cause constipation and the stool color to be, I guess, more black. Pain medication, such as like opioids, are notorious for slowing peristalsis and leading to constipation. Anti-motility drugs, they treat diarrhea, slow the peristalsis, and laxatives, which treat constipation by triggering peristalsis. Next. And here we have some other factors. Surgery, procedures, anesthesia can slow the bowel movements. Bowel manipulation during surgery, that can halt the peristalsis, definitely. Secretions are not moved within the bowel, can cause discomfort. Sometimes an NG tube is used to extract those secretions out of the bowel. Lack of mobility, following many surgeries, people just aren't moving around very much, can lead to constipation. Perineal surgery can cause bowel movements to be very painful and people may ignore the need to go. Anal sphincter surgery may cause uncontrollable drainage. Pregnancy can slow the movements and motility and cause hemorrhoids. And then some pathological conditions, Allergies like food allergies and intolerances can cause things like constipation, diarrhea, rash, bloating, gas, and possibly intestinal bleeding. Next. And there's our references. And that's it. Thank you.